Hi there everyone, how are you today? I'd like to talk to you about something called a lobectomy, which your doctor may have recommended for you. You might be wondering, what is it and why do you need it? Well, they've probably found a tumour in your lungs, which they want to remove. Now, your lungs are made up of different things called lobes, and you can see there's 3 lobes in your right lung and 2 lobes in your left lung. So that's where the name lobectomy comes from, which is an operation where they're going to remove part of your lungs. So it's a very serious thing. And your doctors are going to probably want a lot of tests done before this operation because they want to know, 1, how big the tumor is, 2, where it is, 3, how it's growing, and 4, how much of your lung tissue is involved. So you're probably going to be up for CT scan tests, lung function tests. It could be a bit exhausting, but it's a really good investment in finding out the information for the doctors because they want to make a very precise plan about how they're going to go in there and get exactly this tumor and not take away any more of your lungs than they need to. And they'll talk through those options over with you. In terms of the actual operation itself, the lobectomy, the procedure, there's 2 different ways of doing it. There's a larger slice way of doing it, and there's a smaller slice way of doing it. The smaller slice is the minimally invasive way, and the larger slice is the traditional way of doing it. But I'll explain both of those in just a minute. Why would you choose the larger slice over the smaller slice? Sometimes if there's a very large section of lung involved in the tumor that they need to remove, it's obviously going to be easy to get that out through a larger slice, as opposed if there's only just a tiny little tumor, if it's early stage and they just need to slice a little wedge, then they can just get that out using a smaller slice. So that's one of the reasons. There may be other reasons your doctor prefers to do the traditional or the smaller slice, minimally invasive way. He or she will talk those options over with you. I'm just going to explain the 2 procedures, and here we go. So the larger slice way, they're going to make, like I said, quite a slice here, and well, depending on where the tumor is, because they want to get as close as possible to it. And then they're going to pull the ribs right on either side of the slice apart. So they've got a nice big area to work in. Then they're going to go in there and they're going to remove the tumor. And that sometimes will involve removing that whole lobe or a whole lobe. In rare cases, it might involve removing the whole lung, but that's not very common. Once they've got the affected area, that'll go off to the lab for testing. All right, so and then they will stitch you up. For this operation, you'll be under a general anesthetic in a hospital, and the recovery can be quite long, a number of weeks, even up to months, if depending on your health and wellness and fitness before the operation. There'll be a number of follow-up visits with your doctor, of course, to track your recovery. So that's the larger slice way of doing it, which is another name for that is called a thoracotomy. Okay, and now let's talk about the smaller slice or minimally invasive way of doing it. So let's just say that for convenience sake, there's a little tumor here, and so the doctor's just going to cut out a wedge. But the way they do it in this smaller slice way, they're just going to make a little small slice here about as wide as my fingers. Then they're going to run a tube in there. Inside that tube, there are a whole lot of tools. So there are grabbers, there are cutters, there are all sorts of little tools that are going to do the operation. And then they're going to make a few other little slices around. And through those other slices, they're going to run cameras. And those cameras are going to send a live video feed back to a screen. And your doctor's going to be, the surgeon's going to be sitting at a desk in the operating theatre, looking at a screen, and they're going to be, on that screen is going to be the inside of your lungs. And they're going to be looking, finding the tumor and seeing what they're doing. And then they're going to be having their hands on controllers and operating those controllers, which are going to be operating the robot and telling the robot what to do back here inside your lungs. So it's quite amazing technology. And they'll be operating all of that, looking on the screen at what's going on and removing that problem tissue. And as before, it's off to the lab once it's come out, and then they'll sew up all the, remove all the implements and then sew up all of the smaller cuts. And that's the two different ways of doing a lobectomy.